Hey, it's Abby from the But Am I Wrong podcast. This is where we put the Black woman experience in the driver's seat. I ask the hard questions and then I give my unasked for opinion. After which, the only question remaining for you is, but am I wrong? Hello and welcome to the newest episode of But Am I Wrong? Once again, this is your host, Abby Rose. And if you do not know what we are talking about today, I do invite you to come in and take a seat and let's get started on the newest development in the United States, which is the overturn of Roe v. Wade. And just in case you didn't know what you were getting into when you press play on this podcast, we are going to be talking about how the overturning of this is going to be a death sentence for many Black women, and no one is going to be held accountable. So let's rock and roll and get started. Now, in case you did not know, Roe v. Wade, the overturning of that, what it has done is taken away the federal stance that women have the rights to abortions. And what it has done in that process is giving the power back to each individual state for them to decide if the people who live in their state are able to have abortions there. Now, it also does not mean that another state can keep someone from going to a state that provides the service and they don't. They can't keep them from doing that, but they can make it very hard for that woman or anyone who is going to assist her to make that decision to go ahead and do that. Now, one of the other things to keep in mind is that the experience of Black women in this country is very different from the experiences of non-Black women. And that does include Black women of Hispanic descent. It's totally different from the experiences of women who are Black, who have no other ethnicities or cultures attached to them. Now, there's two very big things that Black women are dealing with in this country that the overturning of Roe v. Wade is going to exacerbate. And that is, one, Black femicide. Black women are killed every 5.5 hours in this country as of 2020. However, we have seen a rise in this since COVID has started because intimate partners are around a lot more because apparently they're not working. And so what that means is right now we're seeing it at a Black woman being killed every 5 hours in this country. And that is from the FBI. So if you don't believe me, I definitely encourage you to go to the FBI.gov website, do some research, as well as just look at your local news, as well as many of the Instagram accounts out there that talk about Black femicide. The one that I will reference quite a lot through this is Black Femicide US. I encourage you to check them out on Instagram and definitely go ahead, check out their link trees that you can download the letter to send to your local representative to ask them to stand up, 10 toes down, and do something about the Black femicide problem. Now, the other issue that we are facing in this country as Black women is medical bias. If you don't know what medical bias is, let me give you an example. Two women go to the doctor. They tell the doctor if they have the very same symptoms. The doctor gives one woman a medicine for it. The doctor tells the other woman to go home. You're perfectly fine. That other woman would be the Black woman 7 out of 10 times. She is not believed. She is not heard. They see us as someone who is, i.e., complaining, being aggressive, thinking we know more than the doctor, and or just plain out lying. And if you don't think this is true, please think of the example of Shalon Irving. Actually, let me correct her name, Dr. Shalon Irving. She worked for the CDC as epidemiologist, meaning that if there's something wrong with your blood, some kind of disease, she would be the one they would call on to find out what's going on so they could provide a cure. She died just 3 days after giving birth via emergency cesarean because the doctor told her that the symptoms she was feeling were not valid. There was nothing wrong with her. She would be fine. They sent her home. She died the very next day. So if you can be a Black woman doctor in this country, tell another doctor the symptoms that you are feeling after giving birth, you should not be feeling them, and they tell you as another doctor that you are wrong and you die, I definitely think that's an example of medical bias. And she lost her life. She left behind children. And she's not the only Black woman in this country who has dealt with that, who are, i.e., everyday normal people, but there's also celebrities who have dealt with that same thing, who have thankfully lived through that, such as Serena Williams and Tatiana Ali, as well as the runner Allison, and I don't know her last name, but I will definitely list all of my reference materials with a link to a blog post afterwards, because I'm the kind of person who believes in providing facts and providing resources. So you'll be having the capability to look at all that information. Now, let's just take a step back and break down some of these stats, because I feel like I may have overwhelmed you, and overwhelming you is definitely not my intention. My intention is to let you know that I believe I am right. And if you believe I am wrong, that Black women are being served a death sentence with the overturning of Roe v. Wade, I encourage you to tell me how, provide the data, and then I will thankfully change my mind. So let's start with the data from the FBI. I said it in numbers that are easy to digest for you in the beginning. 1 every 5.5 to 5 hours, Black women are killed. But let's really think about that. Because when you put it into perspective, that means over 1,460 Black women are killed every single year because they were murdered, killed, all types of ways, by everyday quote unquote thugs, by the people who they know in their community, by people who have been vetted by the likes of the US government and police departments, and they were still murdered. Now, the next thing that I want to cover is the Black women who have died from medical bias. Over 350 Black women die every year from medical bias. Let me just let you rest on that. From medical bias. That's according to the CDC, who also had a doctor who worked for them to die from medical bias. Now, there's other data that has already been collected, that has been researched, and one of the ones that is being referenced more and more each day is the study by Duke University. And this study says that 33% more Black women will die from femicide and medical bias if Roe v. Wade is to be overturned. Well, it is no longer something that's an if, it has been, and this is what we can expect to see in our futures, unfortunately. Now, I don't know about you, but that's something that makes me feel sick, makes me feel disgusted. It makes me feel like, once again, being a Black woman puts you lowest on the totem pole in this country, and no one, i.e. not your killers, i.e. not your government, i.e. not the people who are supposed to care about you and protect you, will be held accountable. Now, if you believe that I'm wrong, I would like to definitely provide you some information that will let you kind of open up your eardrums and realize the things that Black women are dealing with. Now, the first article that I'm going to talk about came out December 1st of 2021. It was written by Sharik Faroiki, and you can actually find this link on newsecuritybeat.com. Once again, I will be providing you this information. And what it shows is that research has shown that women in their perinatal period are at risk. If you don't know what perinatal means, it means pregnant or having just given birth. That is what perinatal means. And I want to just read for you a couple of paragraphs from this article to really put it into your face on how important this is of an issue for the Black women in their community. Quote, femicide is an important but often unreported case of maternal morality. That means deceased pregnant women. This research documents the immediate need for a universal abuse assessment of all pregnant women, write the authors of the self-declared first study to report a definite link between abuse during pregnancy and attempted and completed femicide, the gender-related killing of women. This study was published in 2002, and here we are 20 years later. In this study, researchers examined attempted and completed femicide cases and data on reported abuse in 10 U.S. cities. What they found is that Black women were found to be 3 times more likely than white women to experience attempted or completed femicide. And nearly 20 years later, a study looking at the risk of pregnancy-associated homicide in the United States confirms that femicide is a leading cause of death during pregnancy and the postpartum period. Researchers found that homicide during pregnancy or within 42 days postpartum was twice as high as all other leading causes of maternal mortality, including hypertensive disorders, hemorrhage, and infection. Race and age were indicators for increased risk of femicide. Pregnancy-associated homicides were significantly higher among non-Black females. In pregnancy-associated homicide cases, most victims were identified as non-Hispanic Black women, and approximately half of the victims were younger than 25. The vulnerability of younger women, pregnant women, and Black women to femicide continues 20 years after the first study urged for the immediate need for attention to the role of femicide in maternal deaths in the U.S., and documented the increased risk for Black women. I'm going to pause there. I'm not going to read you this entire article. Once again, it will be linked for you to have access to because I feel like it's something all of us need to take a gander at and realize that even though it's something that does not affect you, doesn't mean it's not real. Now, I know you might be trying to realize or calculate or figure out, what does overturning of Roe v. Wade have to do with this escalating? Well, here it is. Giving someone the right to choose to end a pregnancy if they cannot take care of a child mentally, emotionally, physically, or financially is something that should be provided. Because the number one reason that Black women are normally killed by their baby daddies is because of the fact that the man could not afford to take care of said child, and they really don't like to be put on child support. And mind you, most Black men in America only pay between $100 and maybe $200 per month, though some of them who have children are paying as little as $20 to $40 per month. Now, if a man will kill a woman because he's paying $40 per month in child support, I don't even have words for that. But if you don't think it's going to take it a step up and these killings are going to ramp to a new level, I suggest you put on your seatbelt and buckle up because they are. And you want to know why? We have some states who think they are doing a service to women, and they are not. They want to have child support start at 15 weeks gestation. Now, if you don't know what that means, it means number of weeks pregnant. So when a woman is 15 weeks pregnant, they will find the father, whoever she says it is, and they will commute the starting of child support. Now, let's say the father disagrees that it's not his child. That's perfectly fine, they say. We'll wait till they can do an amniocentesis, which is about 6 to 8 months, where they can go ahead and get some of the baby's DNA. Or they can wait till after the baby is born. If they do this and the father is proven to be said man, he will owe child support back to 15 weeks gestation. Now I get it. They're doing this because they need to recoup the money they're spending on healthcare, that they are spending on housing assistance, that they are spending on the time this woman's off of work and not contributing to taxes. I get it. But it's also going to contribute to more women being taken out earlier and earlier by these very sad moronic, bozo, dusties that some people like to call men. And it's disheartening. It's very disheartening because I feel like we all know someone who has experienced this, or someone who knows someone who has experienced this. And it's something that women in other cultures and ethnicities don't even have to deal with. It is a very much a Black woman problem. Now, the next article that I want to talk about is the pregnancy-related morality impact of a total abortion ban in the U.S. A research note on increased deaths due to remaining pregnant by Amanda Jean Stevenson. I will definitely also be including this article as well. This is the article that actually references the Duke study. This woman has gone into this with extreme detail. She has 2 pages of references notes. She also has a complete algorithm a complete formula that she has established to actually figure this out. Definitely a very keen research this Amanda lady is. Now, one of the things that definitely pulled me in when I read her research was the results. The results are something that just really boggle the mind. Her results are something that really, the only time made me wish that I wasn't a Black woman. Not that I plan on getting pregnant. I am married. I have had my child. I am not having any more. But it still stands to say that I feel bad for women who are going to deal with this because they have not figured out that there's just some men who you should not be allowing into your womb. And that's all I'm going to say about this. So I want to read the results from her study. And once again, this information will be referenced in my blog article that is going to go with this podcast. Results. In the first year in which all wanted induced abortions in the United States are denied, the estimated annual number of pregnancy-related deaths would increase from 675 to 724, representing a 7% increase. And in subsequent years, a 21% increase. Non-Hispanic Black people would experience the greatest increase in pregnancy-related deaths, a 12% increase in the first year, and a 33% increase in subsequent years. Now let's just take a pause there. We are almost twice as likely to, first of all, be murdered while pregnant. And so obviously the risks that come with banning abortion is going to increase overall as well. Then she goes on to say, overall, estimated pregnancy-related deaths would increase for the total population by 7% in the first year of a ban, and by 21% in subsequent years. Because the estimated deaths before and after a ban are based on the same population and fertility rates, percentage increases also reflects increases in the annual risk of dying from pregnancy-related causes. And for medical women, a lot of that will include medical bias. In terms of the lifetime risk of dying from pregnancy-related causes, denying all wanted induced abortions will be associated with an increase from 1 in 3,300 to 1 in 2,800 among all women. Among non-Hispanic Black women, the risk would rise from 1 in 1,300 to 1 in 1,000. Doesn't look good, Black women. It really does not look good. And the only thing that you can really do to protect yourself in this instance is, how do I put this delicately? Choose who you're letting into your womb wisely. And unfortunately, there's no very great way to do that. Because there's been instances of pregnant Black women who have been killed by their husbands. And these husbands have been anesthesiologists, they have been nurses. There's been instances of Black women being killed by their fiancés. And these men were vetted by the U.S. Army. There's been instances of Black women being killed by their quote unquote boyfriends. And these men have been vetted by the police. So, if the police cannot vet these men, the United States Armed Forces cannot vet these men, hospitals and doctor offices cannot vet these men, we also cannot vet these men. None of us have a crystal ball that is going to tell us that the person that we are being presented with today is just a representative and definitely not the person who they are. Because you have to think about it. Black femicide literally means Black women being killed. Femicide, 9 out of 10, is completed by someone the woman knows, an intimate partner, a family member, a friend, someone they know. Someone who you would think would never do this to you is normally the person who does this to Black women. So of years of friendship, months of developing a relationship, years of being related to somebody, if this cannot save you from being killed, what can? One thing I will say is there is a common denominator, and it's the men who are committing these atrocities, not women. So I'll leave you with that, and I'll see you next time on But Am I Wrong? And I really do want to know, am I? Because this is one instance where I would actually like to be. I would like to be wrong. I would like for women who look like me to not have to suffer just because when the dice was rolled, they were born to a woman who looks like me. I'll catch you on the next episode. Peace out. You know what? I think I might also see your side of it. If you're thinking, hey, this is not going to affect women as you think it would. Sure, they'll have to have babies they don't want or that they're not able to provide for physically, mentally, emotionally, or financially. However, let's say something like someone has a miscarriage or, the baby's going to kill them because it's an ectopic pregnancy, or maybe the mother has some kind of disease. Like, for instance, I have lupus, an advanced stage of it. I would not be a candidate for an ongoing pregnancy. And if these women experience a pregnancy or a miscarriage, surely they'll still be able to go ahead and get the services provided for them that will allow them to be healthy and remove anything from a dead fetus that may still be inside her, or stop pain or bleeding or clotting, anything that may be happening to her due to the pregnancy. You're wrong. You're absolutely wrong. You are 1,000 times wrong. And if you don't believe me, let's read an excerpt from an article written by Dr. Leah Torres. She's an Alabama OBGYN. She wrote this article for Slate. I will be also including this information for you to reference as well. And I'm going to go ahead and read an excerpt of her article. If you want to understand the future of medical care for pregnant women in a post-Roe world, look no further than what is happening in Alabama. While Texas's abortion ban, SB 8, has essentially halted all abortions in the state, Alabama offers a glimpse of a troubling future in which the provision of medical care for pregnant people is deeply intertwined with the cultural attitudes that seek to criminalize undesirable pregnancy outcomes. In the summer of 2020, I got a first-hand experience with these attitudes in action. I was astounded by how often patients were turned away from emergency rooms and their doctor's offices in the middle of their miscarriages. No wonder Alabama has the third highest maternal mortality rate in the nation, I initially thought. People are denied urgent medical attention outright, which left me wondering at first if healthcare providers were simply negligent in not keeping up with their medical education, or was this lack of care a reflection of discrimination? Eventually, I landed on discrimination as the cause. But I was wrong. The reality is much worse. Instead, these medical professionals seem to know what they are supposed to do, but choose not to. I came to this realization when I saw a patient in active miscarriage, bleeding, passing clots, cramping, who had just had an office visit with her primary physician. She was forced to wait more than 48 hours in order to get the results of her blood work. Doctors will sometimes check a patient's levels of HCG or human chorionic gonadotropin to help distinguish miscarriages from ongoing pregnancies or ectopic pregnancies. I could not understand why someone with all of the clinical signs of a miscarriage in progress was required to wait for much needed intervention, all the while bleeding and cramping and suffering. I was angry that the patient's doctor did not just provide the standard medical treatment for a miscarriage, surgically removing the contents of her uterus, which would stop her pain and bleeding. Then I saw a different patient who was actively miscarrying and a light bulb clicked on. The doctors were afraid of being attacked by the state of Alabama. Medical providers who treat pregnancy related issues in red states exist in a constant state of fear of performing any procedure that can be classified as an abortion, even while the procedures remain legal. We know that we face the risk of being prosecuted, having our licenses revoked, or even being thrown in jail if we fail to precisely follow every regulation, no matter how arcane or medically unnecessary it is. Part of the problem is a culture that has decided abortion is akin to killing a child. Morality aside, healthcare providers have also been conditioned by the state to fear providing not only abortion care, but management of adverse pregnancy outcomes more generally. Abortion is outlawed in the state constitution, and state lawmakers made their moral position and hostility toward abortion clear in 2018 when Governor Kay Ivey signed the Alabama Human Life Protection Act into law. The law banned abortions at every stage of pregnancy and criminalized doctors, charging them up to 99 years in prison for performing the procedure. Ultimately, a federal court overturned the law, but the state is poised to ban abortion outright through a trigger law that goes into effect as soon as Roe falls. As an OBGYN, I work in active fear of being arrested for providing evidence based healthcare in this state. I am certain that I am not alone. Intervening in an ongoing pregnancy would be examined as an abortion by the medical board and subject to the same scrutiny as any procedure I perform in my clinic. Doctors know that if you perform anything that could even be suspected to be an abortion, you had better have all of your regulations followed to the letter. No wonder, even though we are directed under federal law to provide appropriate medical care to any pregnant person who shows up in the ER with a medical emergency, few in Alabama are willing to risk their careers and liberty to provide their care. That's just an excerpt of her article, and it's quite lengthy. Once again, I will have this for you to reference because I want you to know something. Anything that the nation's women as a collective are experiencing, the data shows that Black women experience these things normally by 2 to 300% more. So for every white woman and Hispanic woman who dies, 3 to 4 Black women die from the same issues. And there's 3 to 4 times more of them in the country than us. So if that's the way that things have already been, and this is the trajectory that our country is on, do you really think this is not a death sentence for more Black women?